So, in my practice as an obstetrician and gynecologist, I see two major groups of patients that are really impacted by the COVID pandemic, and that's patients who are scheduled to have surgery and are awaiting surgery, and are expectant pregnant moms that are being affected. On the one hand, even though the actual care or access to care for the patient is not being affected or compromised, what is different is that the expectant mom may not have the same group of support people that she had originally planned. I know that there are some hospitals in Ontario that are not able to actually allow any support people in the hospital, and that's probably dictated by the COVID outbreaks that may be present at the hospital. It's really to protect everyone, patients and the healthcare workers included. And in some instances, support people are being asked to go home after the birth of their child just because there is physically no space or minimal space. So there are shared rooms in the postpartum ward or mother baby unit spaces that just physically doesn't allow for that physical distancing that we would like to have. If there are two moms and then you add two support people and the baby, you just can't have that happening during this time. And the social isolation aspect of this pandemic is really affecting this group of people. For one, we are telling them to isolate themselves leading up to the birth of their child, and then afterwards, being a new mom, lack of sleep, new baby, all that is already a stressful time. Add the fact that they're asking them to isolate themselves and not have the same support people, not just in the hospital, but even when they get home, that can really affect them, can lead to potentially more anxiety, even more depression for these new moms. They're very particularly vulnerable time at their life. There are some people who may think that they'd rather have their baby at home and give birth at home, but at this time, the hospital is still the safest place to give birth. You have the right people there looking after them. You have the nurses, physicians, and the pediatrics team looking after them. There are certain high-risk pregnancies that definitely need to come to the hospital to give birth. And being at home may be the right choice for some people, but it doesn't mean necessarily that it's the safest place to give birth in the setting of COVID-19.